You don't need more appointments. You need more advocacy. You need to understand what advocacy is. Being an advocate is someone that supports, provides, assists, and monitor. Hi, I'm Angel Mathis. I'm an RN, and I help patients advocate through their healthcare journey, explaining lab results and medical conditions. No, I'm not a physician, but I am an RN, and just ease that stress and anxiety of understanding their healthcare journey. Now, confusion in healthcare can be difficult. We can agree upon that. It can be very overwhelming, especially people, they might have gotten a new diagnosis. They may have issues understanding what their condition is. And that's what my job is. I help explain what that diagnosis is, or that disease process, or that condition, and give you some side effects or some issues that you may experience, and definitely referring you back to your physician for proper questions, or making sure you ask the right questions. In my experience, sometimes we don't always ask the right questions, especially us gals that's over 50. We don't always, because a lot of times we don't want to know. We don't want to know that result. We don't want to understand what actually is going on in our body because of fear, and we have to know what's going on with our body so we can be able to get the proper treatment. So that's where I come in. I want to make sure that you be able to ask the right questions. When you see your provider, I want you to be able to understand your disease process or your condition. I want you to be able to understand your medications. I want you to be able to understand the side effects and why. And it doesn't have to be complicated, and you don't have to know all of the 1,000 side effects, all of the 1,000 risks that you may be having or going through, or you may have questions about. Just understand the basics. And if it's something that's not even on that list, a lot of people, in my experience as a nurse, I've been a nurse about 30 years, so I have dealt with a lot and have seen a lot and have wondered what's people understanding about their medications, because there's a lot of people that are on like 20 and 30 medications at a time. And it's so hard to diagnose. I don't do the diagnosing, the doctor does, to understand. That's very, what is this medication is for, to understand the side effects and the purpose of it. Because if you don't have a loved one, or if you live alone, or if there's someone that you entrust in regarding your health care, you just want to know what's going on and why that I'm on all these medicines, and you might have needed that in the beginning. Now, if you have a really good doctor that's really caring and really understanding and really want to be there for you, they'll break it down, even though the schedule may be hectic. Or they'll reschedule you to be able to make sure that you're comfortable and confident in your medications, your diagnoses, what treatments, if any. It can be medication treatment. It can be exercise. It's not always something so critical where you may have to need a blood transfusion or a chemotherapeutic drug, something for chemo if you have cancer. Just things are so different. It's just case by case. But I wanted to explain that so I can be there for you all, so you can understand. You don't have to be confused about your health care. That's what I'll be here to explain. Just to kind of alleviate the doubt, the uncertainty, and the anxiety and that fear of what could happen. So I wanted to mention there are 3 points that I wanted to mention that you can think about, and that I see and have experience with patients regarding the systems being overwhelming. The systems being overwhelming. You have a lot of people. I've done home health and hospice for many years, and some of them have multiple services. They don't understand what this person is doing for this. They have a nurse, they may have a therapist, and then they may not even have that. They may have what they call a provider or a caregiver. They get it all mixed up, and they don't know who's doing what. so they can be able to get the best benefit of their care. They need to know that. They need to understand, and feel that their voice can be heard. I'm going to be straight up and honest. If you feel like your voice is not being heard, even after multiple times of calling, asking questions, trying to figure it out, and no one's there to help you, I think you may need to have a second or a third opinion. You may need to change agencies. You may need to change physicians, or whatever the case might be. You need to understand your healthcare journey. So just understanding what the procedures are, the instructions are, there's so much, and it can be very overwhelming. And this is up to us as nurses or physicians or who's taking care of you, give you the basic knowledge and go deeper, especially when there's, complex situations that are causing more harm and more hurt, or if you've been dealing with something for so long, it's causing more problems and it has not been dealt with. You need to get a second opinion, a third opinion, or go to the doctor, or go to the hospital, or go to the emergency room, get yourself checked out. Making sure that you get what you need. It's so much around understanding your healthcare journey. There's medications, there's insurance, there's Medicare, there's Medicaid. And then there's some people get third-party insurances, or people that haven't been able, or they have not been able to qualify for special benefits due to their age, but some of them may have disabilities, so you may can qualify for that. So those things I can help you with to understand where you are and what things you can get to provide. So systems can definitely be overwhelming if you don't understand. Number 2, patience deserves clarity. You need clarity. You are worthy of having an understanding. You deserve an understanding. You need to make sure that you know what you're taking, when to take it, how often to take it, how long you need to take it, or just the basic. Doctor ordered a medication. What is this medicine for? At least tell me that. And for how long? Sometimes you have to go a little bit deeper. Now, there are some medicines you've probably been taking for years, like an iron tablet, or a vitamin, An iron tablet is something for anemia, those who have low blood counts. So it helps build up the blood cells and the blood counts to keep you strong and oxygen supported and things like that. So you need to make sure that you understand that you are worthy. You have the right to that. Don't be afraid. I don't care how bad their bedside manners are. Some people are ugly, rude, because there is a shortage of nursing. The doctors are overwhelmed. There is so much going on in that area. And there's so many sicknesses. We're still dealing with COVID. There's so much going on. I want you to feel comfortable and confident and be able to ask the right questions when you need it. And you deserve that. Don't never let anyone tell you that you do not deserve answers for your health care journey. You deserve it, and make them tell you. Tell them that if you don't understand it, have them explain it to your loved one, or your sister, your brother, or someone that you can entrust, that you trust regarding your health care. Number 3, advocacy promotes or protects your dignity. When you have someone to help and support you, me being a nurse, being an RN advocate, and I'm not just trying to sell you anything, but I want you to know what's available and what things I can help you understand. There's still something you can think about. Your dignity needs to be protected. So if you're having someone like me to support you, explain and assist, no, I'm not a physician, but I am a nurse with years of experience, years of medical experience, owning my own home health and a hospice agency, just being in the community as well as working in the hospital, understanding those, what they say, nicks and cranks, or cranks and I don't know what they call it, but just understanding how things work. Some things never change. Yes, research is growing, science is growing, but you still need to understand what's a normal blood pressure, or what kind of diet I need to be on for having high blood pressure, or how much weight I need to lose. Things like that. Those are basic things, but it's so significant in your healthcare journey. You can feel better just tweaking one thing. Start one thing. You don't have to do it all at once. and ask questions. I'm going to say that to the doomsday. Ask questions. And if you don't know what to ask the doctor. Say, hey, I'm not sure what to ask. I need to know everything. And write it down if you don't remember, or bring someone along with you. You deserve that. Your opinion is needed to be heard. And you need to have an understanding about your health care, your medical condition. And that's what an RN advocate does. To motivate you, to encourage you, because some people just need that. They may have their whole disease process known, but some people still need encouragement to just keep making their doctor's appointment, just being consistent. Because some people say, well, I feel good. I don't need to go back to the doctor. You went to the doctor because you were sick, and they put you on medications to make you feel better. So that's why you're feeling better. Your blood pressure is regulated. You have less fluid. I'm just giving a general scenario, a case situation. You feel better because you still would need to continue to follow with that doctor. You might have lost 20 or 30 pounds, sometimes. And the reason in that, sometimes they may adjust your medications, meaning they may stop your particular medication because you have lost weight, you got your blood pressure under control, or they may tweak your medications or adjust it. So it's important to follow through and have those resources available. So I just want to let you know that support is available when you're ready. Reach out, send me a message. Say, hey, Angel, I have a question about this and that. We can connect and see what things we can do for you. So you don't have to be confused about where you are, because there is help available besides you just, depending solely on your doctor. You need to, but sometimes our doctors are so busy, so busy, to the point there's so many people involved regarding, it's just so much movement, and you don't have that time. And sometimes they don't have time. So, that bothers me, because people leave there not knowing everything. Not all physicians, not all. And that's why sometimes they may hire what you call nurse practitioners. They're kind of an assistant to the doctor, or physician assistants. Sometimes they do, some companies or hospitals or clinics, or some personal or physicians that have their own private practice, they may hire help. But that's up to them to do that. But it's our responsibility to make sure we're getting the best health care possible. So if you need support, when you're ready, reach out. You take care. And always remember to live anchored. Living anchored means to understand where you are in your healthcare journey, so you can be smart and be able to make smart decisions. Take care.